Today, the Lions have a new owner. What is the most American-made car? And a conversation with Dr. Paul Thomas on masks. I'm Jairus Days, and welcome to your Daily Detroit for Tuesday, June 23rd, 2020. Before we get going here, just a couple of sentences of shameless self-promotion. Our show is powered by our members. If you value what we're doing each day, consider joining us at patreon.com/dailydetroit. Thanks for thinking about it. All right, let's just get into the show. Sports are a big deal in Detroit, and it's an even bigger deal if a team changes ownership. The Detroit Lions announced today that Martha Firestone Ford, who has led the Lions since 2014, has stepped aside. The team is staying in the family, however. Martha Ford's daughter, Sheila Ford Hamp, has succeeded her mother as the team's principal owner and chairperson. The Lions have been in the Ford family since 1963, when Martha's late husband, William Clay Ford, bought the team for about $6 million. Beyond being active in team affairs the last few years, Ford Hamp is well known in Detroit mover and shaker circles. She is the vice chair of the Henry Ford Museum Complex and serves on the boards of the College for Creative Studies, Henry Ford Hospital, and the Ford Motor Company Fund. As we're just getting this news as I'm recording the show, we'll unpack this in a future episode real soon once some dust settles. Gyms and fitness centers are planning to open at the end of the week across the state of Michigan after a federal judge denied a request from Governor Gretchen Whitmer's office and state attorneys to delay their reopening. On Friday, U.S. District Judge Paul L. Maloney struck down portions of the governor's executive orders, including those preventing workout facilities and gyms from opening back up. Back in late May, a lawsuit was filed on behalf of nearly 180 Michigan gyms, contending that they had been forced to remain closed without any scientific data supporting the governor's orders. Although this is being taken up with the Sixth Circuit Court of Appeals, a number of facilities are opening, including one of the more well-known brands, Lifetime, that has 7 locations in Metro Detroit. They're swinging open their doors on Friday, June 26th at 5 a.m., They say 119 of their 150 clubs across the country have already opened back up. What's a real question is if people will return to gyms like they did before the pandemic. After all, you can open the doors, but you can't make people show up. On Twitter earlier this week, we did a very informal poll about gym reopenings. The results, more than 75% of you said that they're not returning to a gym. Just under 18% said they couldn't wait to get back. And a little over 4% were not sure. There's a shakeup when it comes to what are the most American-made cars you can buy. Cars.com has a metric called the American-Made Index. It uses data that automakers are required to share around just how much of a car and where it's made, plus ranks the new vehicles that contribute most to the U.S. economy based on a number of factors, from U.S. factory jobs to manufacturing plants to parts sourcing. So what is the most American-made car? The Ford Ranger, made right here in Metro Detroit in Wayne, Michigan. Next up is the Jeep Cherokee. That's been on the top before. And third and fourth spots went to Tesla, the Model S and the Model 3, respectively. I will link to the full thing in the show notes. I'd also note that there is a wave of patriotism when it comes to car buying. 70% of shoppers consider a car's U.S. economic impact a significant or deciding factor in their vehicle purchase, and that's up from last year. Cars.com also found that nearly 40% of consumers report they are more likely to buy an American-made car due to the current health and economic crisis. And more than a quarter of respondents said that it was, quote, unpatriotic, unquote, to buy a non-American-made car. That's also up. As far as whole automakers go, not just the brands underneath them, the only all-American-made company is Tesla. They're followed by Ford, Honda, and FCA. Longtime Detroit nameplate General Motors now builds less than half their vehicles sold in the United States in this country. Dr. Paul Thomas is back to talk about what's happening with the coronavirus and masks. But before we get into that conversation, wanted to share that his company, Plum Health Direct Primary Care, is opening up a new location in Farmington Hills. The Farmington Hills location at Orchard, Lake, and 11 Mile Roads opens on July 1st and will be led by Dr. Jamie Qualls. So congrats, Dr. Paul, and also welcome back to Daily Detroit, sir.
Thank you so much for having me. It's great to be here.
Absolutely. I sometimes wish it were under better circumstances, and we were talking about more happy things, but I think it's really important we go over what's happening in the world out there right now.
Yeah, I agree. I'd love to be talking about bars and restaurants and fun things to do in the summertime in Detroit and Michigan, but it's not the case this year.
Yeah, not really. You'll be doing your drinking if you do so responsibly at home.
Yep.
So I think the first thing I want to start out with is that overall, the state numbers compared to other places around the country seem to be looking good. And in response to that, whether I'm out on Woodward Avenue or, wandering around doing errands and things, it seems like there are a number of people who have said, like, this isn't a thing anymore. And I wanted to check in with you. What is going on with the virus right now? And is this something that we should continue to have our guard up on?
Right. I think it's important to note that Michigan has done a really good job. We collectively, the people of Michigan, have done a really good job of staying at home, wearing masks, being judicious about our trips to the grocery store and the other essential places that we need to get our essential items like food, etc. And because of that collective effort, we've flattened the curve together. We're no longer having 1,000 cases each day. We're now having about 100 or 200 cases each day. And yesterday we reported 7 deaths in the state of Michigan. So that's a huge improvement. However, we're at the point where people are kind of resting on our laurels and saying, oh, we did a great job. Now we can go out and party and gather and get together and have events now. And it's just not the case. We need to still remain vigilant about the virus, because when you think about the number of total confirmed cases in the state of Michigan, there's 61,400 cases that have been confirmed, and we have a population of about 10 million. So that means that a very small percentage of the entire state of Michigan has had the virus already, which means there are many more people who have been unaffected, which means it could spread to more people still.
Well, one of the things is that people look at the state government and say, well, if the government's reopening things, it means I should just go right back to it. Or at least some people are thinking that. How should people proceed with their own caution from a medical perspective to be smart around this stuff?
Sure. I think you should continue to wear the mask in public places. And if you are going to have a gathering of people, keep it to fewer than 10 people. If you're going to be out in the community, make sure that you wash your hands before and after you touch your face so that you're not inoculating yourself with a virus that might be on a railing or a door handle, etc. And just continue to use caution. I mean, if you go to a restaurant, make sure that you select a restaurant that's observing the rules that are in place, like less than 50% capacity, having at least 6 feet of space between tables. We were out on Friday, and there were a number of restaurants that we passed by, like Honest John's and Selden Standard and She Wolf, that area of Midtown, that were observing these rules. So, I don't want to scare people and say don't go out at all, but make sure that you're going to places that are observing these rules, and make sure that you're vigilant about your own hand hygiene and wearing a mask when appropriate.
I imagine it's got to be socially difficult for a lot of people to say they're thinking about going to a place, they get there, and then having to make that decision on the fly, like, I wanted to do this, I'm with, my friend, or I'm doing something, and then realizing the place you want to go to isn't following protocol. I got to imagine that's hard for folks.
Yeah, it's definitely tough. And, we don't live in a perfect world, and these are, imperfect solutions that we're faced with. So it's really difficult to make these decisions on the fly, but looking at it from a, bigger picture perspective, you don't want to be a part of the bar scene where there was a big outbreak and then spreading it to your family members and friends and vulnerable people in your life, like the elderly or small children that you might come into contact with. So, you just got to think about the other people in your life who may be vulnerable. And if some place is overcrowded, you might want to skip it for a safer spot.
So one of the keys to limiting that spread is masks. And there's been a lot of stuff in the media and in the podcast media around masks, and even people saying, well, if you wear a mask, you're not manly, or something along those kind of lines. I wanted to talk about masks first off, like the importance of it. And, people a lot of times, especially if we post on Facebook, will say, well, masks don't work. Masks aren't a thing. And then they put up a bunch of stuff about breathing restrictions and all that kind of stuff. Can you share a little bit about masks and kind of the truth around them?
Yeah, wearing a mask is more about protecting other people, and you're reducing the amount of particles that you're pushing out in the environment when you speak or cough or sneeze or laugh or whatever. And by everyone wearing this barrier, you're preventing the spread of the coronavirus, because we know that it's spread through droplets and it can live on surfaces. So if you stop that outflow of this viral particle from your face by wearing a mask, you're protecting other people. And let's say it's the responsible thing to do. Men and women in our country are responsible, and we want to be responsible for the people around us. And by wearing a mask, we can reduce the transmission of this virus. It's the considerate thing to do. It's the right thing to do. It's the responsible thing to do. And it's the American thing to do, because we're protecting the people in our country and the people around us.
So if I am looking for a mask, because here's the thing, like I have one, it's been a while now. And, we went through a phase of just kind of finding whatever we can find and doing what we do. What should we be looking for going forward? Because masks are going to be a part of our, not only our fashion, but it's going to be basically like wallet, glasses, keys, mask for a while.
Yeah.
What are we looking for in a mask? What do we want?
You want something that fits your face comfortably, that you can wear for a long period of time. Some people prefer to have it wrap around the back of their head so they're not irritating the back of their ears. You want it to comfortably cover your nose and mouth. Your mask is most effective when it covers both your nose and your mouth. You want it to fit around the contours of your face. Some people have a higher nose or a recessed chin or something like this. So maybe think about the contours of your face and find a mask that fits you well. And you want something that you can wash easily. So if you're wearing it for a couple days, or if it becomes damp or dirty, you want to wash it pretty frequently to, keep it secure, keep it safe, and keep you from spreading the virus that way.
Yeah, one of the things I've gotten to is actually having multiple masks so that you can kind of flip things out. I kind of look at it the same as laundry.
Sure. Yeah. I mean, you wear one on Monday, you have one for Tuesday, you have one for Wednesday, et cetera. And then that way you have a little rotation that you can go through to make sure you keep it clean throughout the week.
And we're thinking about materials. Is there anything specifically we want to look for, or stuff that we want to avoid for what it's made out of?
Well, I think, again, just something that's easy to wash in your laundry machine at home. So cotton's a reasonable fabric to use because it's easy to wash, it's inexpensive, and if you lose it, it's not a big deal. You can buy another one that's a couple dollars and keep it friendly for your budget as well.
Awesome. Well, Dr. Paul, thank you again for your time today. It's always great to talk to you. As I said, hopefully at some point we're talking about more cheerful situations than, the coronavirus.
Yeah, I hope so too. I know it will come one day, and we got to be patient with this. I know it's been hard for a lot of people, missing out on important events, important travel, nights out with friends. But if we all look at the bigger picture, I think we'll come out of it ahead.
All right, that will do it for your Daily Detroit. If you have ideas on what we should cover, feedback for the show, or just want to yell at me, get in touch at dailydetroit@gmail.com. I'm all ears. A quick reminder that Sven is on vacation this week, so that's why you haven't heard his voice, but I have seen pictures of him out in his element, enjoying the bonfire. It is a beautiful thing, so seems like he's happy up north. Coming up later this week, we're going to talk tequila. Also, Fletcher Sharp is back to talk Pistons and sports, and as you know from the top of the show, there's a lot of sports to talk about. Of course, a lot more and what's happening around town. With that, I'm Jer Stays. Thanks so much for listening. Take care of each other, and I'll see you around Detroit.